Hello and welcome to All Right, Now What? I'm your host, Andrea Gunraj, for the Canadian Women's Foundation. Gender equality and justice where we live, work, learn, and play is the goal, and it makes life better for everyone. This podcast is our chance to connect with insightful people and explore what it'll take to get there in Canada. The work of the Canadian Women's Foundation and its partners takes place on traditional First Nations, Métis, and Inuit territories. We are grateful for the opportunity to meet and work on this land. However, we recognize that land acknowledgements are not enough. We need to pursue truth, reconciliation, decolonization, and allyship in an ongoing effort to make right with all our relations.
Let's say you're walking home one night, listening to some casual Beethoven, as one does. If you're a man, there's a good chance you'll hear it just like this. If you're not a man, there's a good chance you'll hear it more like this. Because women and gender diverse people are expected to always keep one ear to the ground to reduce their chances of being attacked. Does that sound right to you? Visit awarepod.com to learn more and help fight gender-based violence.
So I'm here with Kimberley Okafor. I have a question for you just to launch right off. I want to ask you, you did the Gender Equality Changemaker quiz. Give me a sense of your thoughts on the results. Do you agree? Do you disagree? Are you shocked? Are you feeling like, yeah, this is about right? Give me a sense of your thoughts around that.
Yes, absolutely. I was honestly surprised by my results, but in the best way. Being almost evenly split between challenger and collaborator really made me reflect. And I've always been someone who questions systems and pushes for justice, especially in maternal health. And at the same time, I genuinely value collaboration and believe that real change happens when people come together with a shared purpose. So, as I thought more about it, I realized that even in my volunteer work, I've been more drawn to roles that aim to create meaningful impact. I currently serve as an outreach coordinator for Project Impacting Lives, which is a youth led nonprofit organization that's dedicated to supporting homeless individuals. I'm also involved with Black Researchers Initiative to Empower, which is a student based group that supports students pursuing science and medicine related research careers. So I would say that both of the spaces have taught me the importance of working collectively and with more intention. Now, for the creator part of my results, they also resonated with me because I like to design new stuff and uplift underrepresented voices, especially through my research. And for the last part, which was the connector part, it really, even though it was a bit lower, I think I still resonate with it. I just think it means I'm more intentional about the relationships that I build. And I guess I focus more on creating more meaningful connections. So it's based on where they count, as opposed to, I do believe in quality over quantity.
I mean, I think that's such a great thing for us to always do in everything is quality over quantity. And even where sometimes you have quality, the quantity then becomes like a question. How can you have quality? How can you have quantity? You're doing so many different things. And I think a lot of people that we speak to have such a diverse and dynamic experience, and they bring that to the table when it comes to addressing gender equality and growing gender justice. I would like to ask you about any core life lessons that you would share with us that you bring today to the effort to make a gender equal Canada.
I would say one of the biggest life lessons that I bring to the work of gender equality and justice in Canada is that systems don't change unless we truly listen to the people most impacted by them. And I know that may sound simple, but it's actually very radical in practice. For instance, in my research, I focused on how mothers from all backgrounds, including those from marginalized communities like Black and racialized women, navigate Canada's maternal healthcare system. And what I've consistently seen is that their voices are often silenced or dismissed and completely left out of the conversation. And after completing hundreds of surveys and having a lot of interviews with in depth conversations, I've learned how powerful it is to treat lived experiences as knowledge. And it's important because it's not just anecdotal, it's central. And listening is so important to me because I find that it's not passive, but it's an act of justice. And it's honestly in those stories where real solutions live. So I think because of this experience, I would say it has shaped not only how I do research, but how I move throughout the world. And whether it's through advocating in an academic space or mentoring others or even being within the community, I've learned that the most important part about creating change is ensuring that you listen consistently to those you want to help. Because once you do, you start to realize that gender justice is not just about representation, but it's about transformation.
I appreciate that. I mean, I have heard this over and over again. Representation matters. Representation matters. And sometimes, like, I don't disagree with that, but I have a feeling that justice has representation as a starting point and transformation is the goal, and everything in between is a ton of work, and it's more than matters, it's essential. It's clear that you have a lot of passion for Black maternal health and reproductive justice. Can you tell me more about your project that you're working on and some of the insights that you found along the way when it comes to what we can do to address this issue that is really, really underaddressed? And you hear so many horror stories and difficult situations, but just from the people that you know, let alone, on a broad scale across the country. Give us a sense of what you're working on here.
Absolutely. I would say for my research, what I focused on for my master's thesis was focusing on maternal health care. And I decided to use an intersectional lens to truly understand the experiences of all mothers, keeping into account focusing on marginalized groups or mothers who belong to vulnerable populations. So I guess for that, I was really passionate about understanding the impact that factors like race, income, socioeconomic status, how that affects maternal health care, how that can affect access to healthcare services. And I would say when it comes to advocating for, equitable healthcare, I'm very passionate about understanding more about the disparities in healthcare. So by identifying these disparities, what are the solutions? What are ways that we can enhance maternal care? And that could be through, focusing on preventative screening. It could be focusing on access to reproductive care, or even the way sometimes women's symptoms are often dismissed or misdiagnosed within our healthcare system. So it's very concerning because a lot of these disparities are often pushed aside. And especially when it comes to Black maternal health, given the stats in the States where Black mothers are 3 times more likely to die during childbirth than their white counterparts, it's a very difficult and stressful situation. And given that in Canada we lack that data, I'm very passionate about understanding the role that race plays in the Canadian context. And then if so, if race does play, a significant role, finding ways and finding solutions to ensure that all mothers, regardless of race, are, having equitable healthcare, that they have, they're being heard, that their voices are heard at the end of the day. So overall, I think even in areas like maternal health, which I focus on in my research, the experiences that women face often highlight the broader problems in our healthcare system. And it's important for us as researchers, as people who advocate for change, to ensure that we're listening to all mothers, to ensure that all voices are heard, because that's truly when change can happen.
Thanks for that, Kim. I wonder if there's any, I know that this is a data gap in Canada. Is there any hints and thoughts around where Black maternal health is today? I've seen some data that shows that risks, for instance, in the birthing process is huge for pregnant women who are Black. Any other data that you would help us to just understand the scope of this problem, maybe what it might look like in Canada, even though that is a huge data gap we have to fill?
What comes to mind first is the Black maternal mortality rate in the UK. So in the States, they do have a different healthcare system, but when you look at the UK, they have a similar healthcare system like Canada, where they offer free healthcare for their residents. So despite, having a similar system, the UK still collects race-based data. And based on the stats in the UK, it showcases that Black women are 3 to 4 times more likely to die during childbirth. So I think by focusing and looking at other nations that have similar healthcare systems like us, provides us with more insight, and it can help us, try to gauge where it's at. There are a lot of other factors overall that contribute to that as well. For instance, socioeconomic status, neighborhood status, factors like even implicit bias when it comes to, your healthcare provider. It's very important to, truly assess and understand that it's not just one specific issue, but it's a variety of factors that come together and overall shape and impact how Black mothers perceive their quality of care. So it's definitely important to look at it from a holistic approach and look at all the factors when it comes to both the prenatal but also postpartum experience.
Oh, thanks for that. That's really helpful. I wonder when you say quality of care, anytime I hear these terms, I think if we had perfect, wonderful, high level quality of care, what would that mean for somebody who right now has lower quality of care? You have any sense of what great quality of care will look like for maternal health, Black maternal health, and just anybody who's facing these higher impacts and greater risks in the process?
Absolutely. I would say when it comes to the quality of care, I definitely, the first word that comes to mind is culturally competent care. So ensuring that healthcare providers are culturally sensitive and are respectful of different cultures, I think that's especially important in the field of, maternal health because, mothers come from different backgrounds, they have different beliefs. It's important to be respectful, but also be aware that other people have different values and different belief systems. So it's important to have that respect as well. I would then say when it comes to quality of care, implicit bias, as I mentioned previously, is very important to address, given that sometimes within our healthcare system, healthcare providers they may have biases that may impact their decision making process, preconceived beliefs or notions about a particular racial group. So it's important to identify those beliefs, those preconceived ideas, and to ensure that it's not affecting how you communicate with your patient or how you communicate with your client. So at the end of the day, it's ensuring that you're setting aside any biases that you have, or if there are other factors like culture, for instance, you're ensuring that you're in a respectful, inclusive, diverse environment where voices are heard. So just making sure that it's a safe space for mothers to be able to speak and be able to talk about their birthing experiences or their maternal care is very important.
It just underscores again, I think, why we have to really take serious this idea of training people, holding people accountable in their jobs when it comes to how they treat their patients. And I sometimes worry a bit about how that's going to be in the future when all these important kinds of training on intersectionality and how you bring that to the day to day level in your care and your work. I really worry about that nowadays. We're questioning the value of that. And I would argue we haven't even gotten halfway where we needed to go. That was just the beginning, and now these things are being questioned. I would just love to hear your thoughts about how we can reaffirm this in our medical system, for instance. And of course, medical system is one of many systems, but anything that you can think of, maybe some topics that you feel people need that training on.
I would say it would come down to, diversity within the healthcare sector, being able to interact with patients from different backgrounds, different religions, different ethnic backgrounds. I think that's definitely important to help people become more aware of that. I also think, even in terms of policy, the collection of race based data in Canada, I think it will provide us with more of a, you know, greater understanding. It would help guide researchers and policymakers to really identify those key areas within our healthcare system that predominantly affect marginalized groups. So I think by advocating for the collection of race-based data, which Canada now we're kind of getting to that place where we realize that collecting race-based data is essential and that it's going to help us when it comes to our research identifying disparities. It provides the baseline. It provides the foundation for us to be able to truly identify what those key disparities are and how to effectively resolve them. I definitely think by effective training with healthcare professionals when it comes to policy advocating for race-based data, but then also, as you also talked about before, it's also important for us as people who continuously advocate for change to continue to spread awareness about this because sometimes because of the lack of data, because of the lack of research, not a lot of people are often aware that it exists. So it's important through various platforms, even through social media, to constantly advocate. And it could be big or small. It could be within your community. It could even be having a conversation, with, one of your friends. It's definitely important to keep the conversation going to ensure that, we're continuously, striving towards better equity and quality care for, marginalized groups and marginalized mothers.
My last question for you is, all right, now what? I would love to hear what you would share as a powerful takeaway for our listeners on how we can be better gender equality change makers. I heard you loud and clear when you're saying awareness. You're saying that data advocacy, data is power, and that's really important. Any other key takeaways you would give to us when we're trying to strive to be that gender equality voice that we need so badly more and more?
I would say my key takeaway is to, constantly listen to those that you want to serve. I think that's such a key important part when it comes to service and for helping communities. I definitely think sometimes, the data it's there, or, in our case, we have very limited data, but I definitely think it's important to continuously build relationships, build that trust within our communities to ensure that all voices are heard. So my key takeaway message would finally just be to ensure that all voices are being heard, to continuously advocate, to build networks within our communities, and to ensure that we're actually actively listening to those that we truly want to help. It's important to be an active listener and to ensure that we're helping those so that we're not, overstepping, and we're not, thinking about certain solutions that, they may not even think about. So I think it's definitely important to take into account what they truly want. And that's how I do believe we would effectively, continuously to strive towards gender equality in Canada.
All right, now what? If you want to make sure no woman, girl, two-spirit, trans, or non-binary person feels out of options, out of sight, out of time, or out of mind, visit yescountmein.ca. When you count yourself in, you'll join over 104,000 people in the Canadian Women's Foundation's community. You'll get tools and opportunities to advance gender equality. This movement needs you. Visit yescountmein.ca and count yourself in today. Please listen, subscribe, rate, and review this podcast. If you appreciate this content, please consider becoming a donor to the Canadian Women's Foundation. People like you will make the goal of gender equality a reality. Visit CanadianWomen.org to give today, and thank you for your support.